All right, so you are here to get powder brows today, correct?
Yes.
Okay. Do you have any allergies to any medications or anything like that?
No.
No? Okay, so what I'm gonna do is I'm gonna clean your eyebrows first thing with some alcohol wipes and scrub them a little bit and get them numbed. So I'm gonna clean around the forehead as well because we wanna get rid of all those oils in the forehead. That way, if our forehead is nice and clean, the mapping string will mark really, really nicely. Exfoliate both eyebrows. And then after I numb, we're gonna talk a little bit about what it is that we're gonna be doing. Explain to her what powder is. Talk to her about the shape that we're gonna give her. Are you familiar with what powder brows is?
No.
No, so it's a semi-permanent procedure. I'm gonna do the shape on your eyebrows and we'll talk about the shape a little bit. So I'm gonna draw out the shape and then I'm gonna go in there and fill it in. And it's gonna look like when you grab like Anastasia pomade and then you fill in your eyebrows, it's kind of gonna look like that. And I like to naturally do an ombre powder, which means at the tail is darker, at the arch is a little bit lighter, and then towards the front is more lighter. That way you have a nice ombre and it doesn't look like you grab a Sharpie and like draw on your eyebrows. I like to work really natural, so I'm gonna give you a natural look. Okay. And then in 6 weeks, you have to come back for a touch-up if you want them to stay. Right now you're a model. So if you want them to fully stay, you have to come back in 6 weeks and we're gonna do the whole process again and then they'll stay about 12 months. Okay. That's the average length that they last is like 12 months and then every 12 months you need a touch-up. Okay. If you don't get that touch-up, with time, they'll fade away completely. So it's up to you. Can I get your phone number?
309-472-9232.
Okay. So in this form, the front page talks about you giving me the consent. And here it's asking if you're older than 18.
Yes.
If you're under the influence of drugs or alcohol today.
No.
Are you pregnant or nursing?
No.
Okay. If you were pregnant or nursing, we would ask you to get a doctor's note. And if you're nursing, what I've noticed is that if clients are nursing, they don't retain the pigment as much. So they fade a lot sooner. Yeah. And so it's not like you can't get it. You can still get it, but you're probably going to lose a lot of the pigment. It says that I have to inform you of the possible risks, complications, consequences. Like anything you do, like we were talking about, like getting your piercing, you could always get an infection. We never know how your body's going to react. Right. So there's always a chance of infection, but I've done plenty of girls and no one has ever had an infection. This procedure is pretty safe. Everything that we use is super clean. The needles are a one-time use and then we throw them away. So everything's super clean. So it's really hard for you to get an infection unless like you were to go home and like touch them with your dirty hands, then you could get an infection. But other than that, there's no risk of infection. Possible allergies, you said you don't have any allergies, so I wouldn't worry about it. But if you were a person who is allergic to multiple things, then I would probably do like an allergy test on you. And then we would have to wait like 48 hours to see the results. But you're not allergic to anything, so I'm not gonna worry about it. I can't guarantee that your eyebrows are gonna look exactly like the eyebrows that I did on someone else. Even if I did almost the same shape, used the same pigment, used the same technique, they're never gonna look identical because you guys have different skin types. You guys are different ages. You might be taking more medications than she is, or she might be taking more medications than you. So those are a lot of factors that can affect the results. And then on here it says that you have to follow the aftercare instructions for you to have good results, meaning I don't want you to get them wet for the next 3 to 4 days. So a little bit of water on them is fine. I just don't want you to sit directly under the shower head and have them soak off. So wait at least 3 to 4 days before you can expose them to a lot of water. I'm going to give you an aftercare cream ointment, and you're going to put that on once a day with a clean Q-tip. And you're just going to dab it on. You're not going to rub it in like this. You're just going to dab it on really gently, because we don't want to pull that scab off. Because in the next 3 days, you're going to form a scab, and that scab will come off on its own. When the skin already absorbed the pigment and is ready to let the scab go, it'll release it on its own. So don't pick it ahead of time, because you could end up with like patchy eyebrows. And then in 6 weeks, you have to come back for the 6-week touch-up. I am not liable for the results, and I cannot guarantee my work if you don't come back in 6 weeks. So just be aware of that. And then the photos or videos that I do take, I use them for social media, especially Instagram. That's like my professional page, and that's where I upload everything. Okay. So then we're going to talk about the back side. And these are just a whole bunch of health questions. Are you diagnosed with any health conditions?
No.
Okay. Are you taking any prescribed medications?
No.
Okay. And you said you're not allergic to anything. Any vitamins or anything like that you take? Supplements?
No.
Oh, okay. Do you use any specific skin cleanser when you wash your face?
Yes, but not daily.
Okay.
Yeah.
Just try to avoid, and while they're healing, try to avoid like hyaluronic acids and like retinol. Try to avoid those. Everything else is pretty safe. But during the healing phase, we don't want you to get like any facials or any chemical peels, exfoliations, nothing like that.
Okay.
When you go to the dentist, do you numb pretty well?
Yeah.
Okay. When you numb pretty well at the dentist, it lets me know that you're probably going to numb really good here. If you don't numb very well at the dentist, and it lets us know that we might struggle a little bit with numbing. That's why we ask this question. When you cut yourself, do you heal pretty nice? Or do you get like a raised scar?
No, I heal pretty good.
Okay. Sometimes if they cut themselves and they have like a raised scar, we might run into the risk of them like not healing properly. So that's why we ask that. When you cut yourself or when you burn yourself, does your skin change colors? Like that area, does it get lighter in color or darker in color?
Usually it gets lighter.
Lighter? Okay. So that's hypopigmentation. Hypopigmentation means that the skin, when they cut themselves or burn themselves, the skin tone changes to a lighter tone. Meaning that sometimes when we do your eyebrows, when the scab comes off, if your brow doesn't grab onto that pigment and the scab comes off, it might turn into a lighter color. I don't see that happening. I see that happening more with like women who have darker skin tones. That's when I see something like that happening. So I'm not worried about you because you're pretty light skinned. And on here it asks what type of skin color you are. So I'm gonna say, when you're in the sun, do you burn or do you tan?
I tan.
You tan? Okay. So I'm gonna say sometimes, rarely burns, always tans. So I'm gonna choose that one for you. And you said you're not breastfeeding?
No.
Okay. Do you get, are you exposed to the sun a lot?
No.
You don't go tanning? Okay, perfect. So now what I'm gonna have you do is you're gonna print your name here, sign, and then in the front page, you're gonna put your initials in all the lines and then sign at the bottom. And while you do that, I'm gonna go ahead and set the tray. Okay, so she's still numbing. I'm gonna let her numb for like another 20 minutes. While she numbs, I'm gonna set up the tray, but I did already wash my hands with Hibiclens. A lot of artists use antibacterial soap, which is good, but I like to use Hibiclens just because it's an antimicrobial, so it gets rid of germs, bacteria, bloodborne illnesses, and many other diseases, so it's a little bit more strong. But you do have to moisturize your hands a lot in between clients because it dries out your skin. So if you're doing like multiple clients a day, your hands are gonna get pretty dry. So what I'm gonna do is I'm gonna grab a pair of gloves, and these are my setup gloves. These are not the gloves that I use on the client, just because they're not very flexible, they're really stiff. So I'm just gonna put these on to set up the tray. And then I'm gonna take them off and set them underneath the tray. And then these are the gloves that I'll use to take down the tray after the visit, because the tray will be full of like blood and pigment and stuff. So I'll take down the tray with these and then toss them in the garbage. So I use 2 different sets of gloves. I'm gonna grab my wipes. And you guys have access to all these materials on the material list in chapter 1. And they do have a link right next to everything. So you can just click on the link and it'll take you directly to the website where you can buy everything. So I like to grab 2 to 3 wipes because I like this tray to be really wet. Because if it's really wet, when I put down the plastic, it'll stick to the tray and the plastic won't move. So it'll stay there. And then I use the wipes again and place it down so that it sticks onto the tray. And I always put these wipes down because I'm gonna use these wipes to clean my phone. So the first thing we need is the calipers to measure her brows. We need the machine. We need the Sharpie pencil. And I have everything organized in order in which I need it. Q-tips, lint-free wipes, the aftercare cream, the ink ring, the Coband mapping string, a couple of the skinny Q-tips so we can clean the mapping and the shape so it's nice and crisp. I use about 3 of those, a Tinkle razor so we can clean her eyebrows, and then this little ink holder. I put a little bit of Aquaphor underneath so that it sticks onto the tray and it doesn't move around. And then in that, I put the secondary numbing, which is the Duration, the Ultra Duration numbing cream. And that has epinephrine, so it's epinephrine and lidocaine. Epinephrine is a vasoconstrictor, so it'll help reduce the swelling and the bleeding. And then the lidocaine is a numbing agent. And then I'm also getting ready her aftercare cream baggie to take home, which is just a little container with Aquaphor. That's all I use is Aquaphor. And she gets to take that home. I'm also gonna put it in there, the aftercare instructions. Even though I already verbalized the instructions to her, I like to put a copy of it in her little baggie because sometimes they forget or they have questions, and that way they can just look at the instructions that I gave them and they can just go from there. Sometimes clients will still call you after they read the instructions, or they just forget they have the instructions and they'll call you or they'll text you asking you if it's normal that their eyebrows are getting super dark, is it normal that they're cracking and stuff like that. And so you just have to reassure them that it's totally normal. Okay, so that is that. I have everything I need from here. I'm gonna go get the ointment, and then underneath here I have wipes. So I grab a lot, like 4 to 5, 2, 3, 4, 5. I have 5, and that is what the tray looks like. So I have everything that I need. Now what I'm gonna do is I'm gonna take the tray over to the table or the bed. I'm gonna put this on the pillow side of the bed. And then I'm gonna, oh, I need my gloves too, the gloves that I'm gonna work with. So here, I like to get the nitrile gloves because they are super flexible and stretchy. So you have better movement with your hands. These are vinyl and they're super stiff. They're not stretchy or anything. So I'm gonna take these off. And my hands are still clean, remember, because I just washed them. I'm gonna bring the client over and have her sit on the bed and then start mapping her. And then after I map her, I'll set up the machine.